Hi, my name is Jennifer Craig, and I'm going to be talking to you about public health legislation. The state of Georgia has had a horrible time dealing with COVID-19 and trying to keep people well. The legislative proposal would be able to make sure that healthcare workers will have the protective equipment and supplies that they need in case we have another emergency like the COVID-19 pandemic. The elimination of inconsistencies need to be eradicated so that people are protected to the fullest ability possible. The aim of this study is to ensure that people around the state and the world would feel safe and know that they are protected to the fullest ability when working around COVID. When COVID first started, we were having to be without some necessary equipment and safety devices. Sometimes healthcare facilities ran out of masks and gloves. The unthinkable was happening. Healthcare workers had no choice but to work anyway to care for their patients. I think that if the state worked with healthcare facilities more, then that would help open up communication on what hospitals or facilities need. Lack of PPE and inadequate social distancing are the two modifiable risks that are addressed through the implementation of enforced physical distancing, increasing the available of PPE, and proper guidelines would significantly reduce transmission rates and help to save lives. Elrich et al., 2020. The problem. The problem that we have faced and are still facing is the unknown from COVID-19. We are still currently going through COVID and trying to navigate unclear waters. I think that the government needs to make supplies be readily available and accessible to all facilities. The problem is we ran out of supplies and that we would keep our healthcare workers safe. This should not have happened. We weren't protected. We as healthcare workers deserve to have the necessary protective gear to be able to keep safe and provide care. It's not fair that we as healthcare workers worked through COVID not having what we need. The risk is greatest among individuals in direct contact with COVID-19 patients who report inadequate PPE availability or were required to reuse their PPE, supporting the importance of providing sufficient high-quality PPE. Nguyen et al., 2020. To implement more protective equipment being readily available to healthcare workers, I would propose to the legislation that every healthcare facility needs to have protective gear sent to their facilities. I think production should start having to make and produce more protective equipment to make sure if we are faced with a surge again, that all healthcare workers will have what they need and hopefully they will not run out. With healthcare facilities having backup protective equipment readily available, if and when needed, this will pose a positive stance with all healthcare workers. By presenting this idea, I feel like we will be able to help healthcare workers remain positive about providing PPE for healthcare. As healthcare workers, we need to be able to protect on all levels. I would also include that I would approach legislators with how several healthcare facilities were not able to properly be protected when the COVID-19 pandemic began. Running out of supplies and protective equipment is not acceptable. It is one of the worst things to have to choose to take care of patients that have COVID-19 or worry about infecting yourselves and having to take it home to your family, or worry about catching it yourself because your occupation couldn't help to protect you while you were doing your job. As healthcare workers, we need to be able to be protected on all levels. We shouldn't have to choose between our patients or ourselves. I want my stance to be that every healthcare facility should start receiving shipments of protective equipment so that when we have another surge, or if we have another surge, we will be readily available to our healthcare workers for protection. In conclusion, we all have been learning as we go throughout COVID. I think as a healthcare worker that we shouldn't have the equipment, that we should have the equipment and the protective gear we need to be able to provide adequate patient care and to be able to protect ourselves while doing it. We put our lives on the line every day with providing excellent patient care. The least that the government can do is to keep their healthcare facilities, professionals protected. As we progress through open waters and learn more about the challenges that COVID has pushed upon us, we want to make the best decisions for our patients and ourselves. Thank you.